Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? Huh? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's not enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwede sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing. Magandang araw po sa inyong lahat. Ako po si Sheila, ang inyong host, at narito po tayo muli sa Simply Nature Success Stories. Napakapalad po natin ngayong araw dahil napaunlakan po tayo ng isang lung cancer patient na may very inspiring story na ibabahagi po ngayong sa ating lahat. Magandang umaga po, Ma'am Violeta. Salamat po sa pagpapaunlak niyo sa amin ngayong araw na ito. Maaari niyo po bang ipakilala ang inyong sarili sa ating po mga manonood?
Okay. Sige, salamat sa inyo. Ako po si Violeta. Magsi-67 years na ako. Na-diagnose po ako nagkaroon ako ng lungs cancer na stage 3C. Halos stage 4 na daw yun. Ay, nung 2022, nag-ubo-ubo na ako pero gumaling. Tapos nung 2023, inuubo na naman ako. Hanggat sa ang plema ko is may dugo. Hindi ko yun sinabi sa mga anak ko. Nilihim ko yung gawa nga ng akala ko TV lang. Mga buwan ng May, sinabi ko sa kanila. Alam naman nila yun na ubo ako eh. Pero sabi ko, hindi na maganda. Ang sabi ko, may dugo na yung may dugo na yung plema ko. Di pina-x-ray nila ako, mayroon ng findings na mayroon bukol ang lungs ko. Ang ginawa naman ng doktor, naman ako, CT scan with contrast. Yun nga, nakita mo, bukol sa sa lungs ko is malaki na. Hanggat sa napansin ko naman na mga buwan ng June o July, mayroon na akong nakapa dito mga bukol. Sa liig ko binayopsy. Hanggat sa dumating ang result ng biopsy after 2 weeks, hindi na maganda. Dahil nga sa mayroon akong lungs cancer, stage 3C. Ayaw ko kasi nagpa-chemotherapy noon. Pero dito sa bahay, nagpakuha ako ng oxygen tank, malaki. Hindi na ako nakakakilos kasi noon eh. Halos nakahiga na lang ako, pupunta ng CR, pagbalik ko, salpak agad ng oxygen. Dahil sa grabe na nga. Talagang ang isip ko, kung anong gamot ang makakalunas.
Kayo po ay gumamit ng Simply Nature PPARS. Ano po yung mga naramdaman yung kakaiba o pagbabago?
Nung dati pa man, bago ako binayopsy, na nagsisimple nature na ako siguro mahigit ng 1 buwan, Maganda dahil yung dugo ng plema ko nawala doon sa PPARS liquid. Nawala yung dugo. Hanggat sa ma-biopsy nga ako, mabigyan naman ako ng yung gamot ng biopsy, magaan-gaan na ang magaan-gaan na ang pakiramdam ko kasi wala naman ng dugo.
Naisabay po ninyo itong Simply Nature PPARS dun sa GPT po, no, yung targeted therapy po na nasabi ninyo kanina. So, nagkaroon po ng magandang improvement sa loob po ng isang buwan, tama po?
Mula nung mag-PPARS liquid ako, na mga nakakailang box ako, nawala yung dugo sa plema ko. Yun naman ang guminha-ginhawa ako. Hindi, ang pagdating ng result ng biopsy at naresetahan ako ng gefitinib, ang bilis lang. 4 na beses lang akong nakainom. Nawala na yung ubo ko, nawala na yung plema ko.
Para po sa kaalaman ng lahat, ang isa po sa maganda sa Simply Nature PPARS is kapag po ito ay naisabay sa conventional treatment, kagaya po ng chemotherapy o kaya po prescription medicine po na re-prescribe po ng mga oncologist, ay may pagkakataon na mas napapalakas po natin yung bisa or yung effectiveness po, no, ng mga gamot na ito at mga treatment na ito, lalo na kapag kasabay po ng PPARS. So, I think ganun po yung nangyari po sa inyo. No?
Kasi bago pa man ako na diagnose ng may lungs cancer ako, ayon doon sa biopsy, nainom na ako ng PPARS liquid, saka PPARS ng tablet. Nawala yung plema ng dugo ko. May 1 buwan na rin. Ang ganda ng epekto sa akin. Ang sigla ko na, 1 buwan, 1 linggo. Hindi na ako nahingal, hindi na ako nag-o-oxygen.
After po na, so nagtuloy-tuloy po kayo ng gamit din po ng Simply Nature PPARS?
Hanggang ngayon, nag-Simply Nature pa rin naman ako for prevention na pampalakas din ng resistensya. Hanggang ngayon, nagiinom pa rin naman ako.
Pati po yung mga nodules o yung kulani po ninyo, no, o bukol sa leeg, ay nawala.
Nung nainom na ako nung gefitinib, yung mga bukol dito na nagdamihan, ang dami po na talaga dito ng bukol. Awa ng Diyos. Unti-unti na rin yun, araw-araw, kada umaga, kinakapa ko, ang liig ko nawala. Pero tuloy-tuloy pa rin naman ng inom ko nung PPARS kasi yun nga ang nakakaganhawa sa akin. Pag nakakainom ako noon, medyo malakas, parang maginhawa bang huminga. Kahit may iniinom naman ako ng hindi na ako hindi na ako nag-oxygen. Kasi nga maginhawa na ang paghinga ko. Hindi naman sa wala akong tiwala sa mga chemotherapy, pero ang dami ko na kasing nakikita na mas lalong daming naaapektuhan ng chemotherapy. Kaya ang ayaw ko talaga ng chemo, hanggat maaari gusto ko na lang yung alternative medicine. Yun na nga, di naman din ako nagpabaya. Nainom ng binibilhan naman ako ng mga anak ko ng mga daming mga herbal. Pero ang naramdaman kong mabisa o maginhawa sa pakiramdam ko ang PPARS. Kaya yun ang tinuloy-tuloy ko. Basta ako mahigpit akong sinasabi ko sa kanila, ayaw ko ng opera. Ayaw ko din ng chemo. Kasi hindi ko kakayanin na yun. Mag-antay-antay tayo ng panahon kung effective itong kasi ang tinira ko na lang, hindi na ako nainom ng iba pang mga alternatives. Sabi ko, ito na lang, dahil ito ang nakakaginhawa sa akin, PPARS nga.
Last January, nagkaroon po kayo ng CT scan. Ano po yung dumabas na sa CT scan ninyo netong January po?
Sa CT scan nitong January, ito lang 2024, is maayos na. Hindi na, wala na yung mga bukol. Kasi kahit si Doc Jansen naman noon, gusto niya na rin ako ma-CT scan para daw malaman, curious daw siya kung ano daw yung nangyayari na sa bukol ko. Maayos na, wala na yung mga bukol. Parang cavity na lang daw yung naiwan ng mga pinag-alisan ng bukol. Yun.
Dito po. So parang ito yung parang naging resulta po, no? Nung pag-combine po ninyo ng PPARS at saka po ng GPT po, no? This past months po. Ano po yung mensahe na pwede niyo po maibahagi sa kanila sa mga katulad po ninyo na nasa kalagitnaan po ng cancer journey?
Laban lang. Huwag tayo mawala ng pag-asa. Ang cancer, nagagamot. May Simple Nature, may PPARS, maganda. Yun talaga ang naranasan ko na guminhawa talaga ako. Nung medyo inatake ako ng todo, gusto ko uminom kaagad, kaso lang inom ko lang. Dahil yun ang maginhawa sa pakiramdam ko na pag inuubo ako, nakakaginhawa naman talaga.
Ma'am Violeta, maraming salamat po sa pagpapaunlak niyo sa amin at pagbibigay po ng panahon para maibahagi niyo po yung inyong inspiring story po no sa ating mga kapwa-pasyente na nasa kalagitnaan o may pinagdadaanan din pong laban against cancer.
Ay, ako si Violeta, 67 years old. Na-diagnose po ako ng lungs cancer, stage 3C. Dati po, hirap ako sa paghinga, naubo, at ang plema ko lumalabas, maraming dugo. Talagang hindi ko na rin alam kung paano. Nung mag-take po ako ng Simple Nature's PPARS liquid at PPARS tablet, maginhawa po ang aking pakiramdam at nawala po ang dugo. At sa ngayon, hanggang ngayon, maayos na po ang pakiramdam ko. I trust Simple Nature. Maniwala po tayo.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's not enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwede sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing. Hi everyone, I'm Sheila and welcome to another enlightening episode of Simply Nature webinar. This program is brought to you by Simply Nature International and Simply Healed Medical Group. Discover how cancer patients can benefit from PPARS because tonight's topic is entitled Lung and Tongue Cancer Healed Naturally. Tonight, we gather to explore the latest advancements, strategies, and therapies designed to combat these formidable diseases. Lung and tongue cancers pose unique challenges, and it's crucial to understand the most effective methods and strategies for this management of this disease. We extend our sincere gratitude to each and every one of you for tuning in to this webinar, and we encourage everyone to share this online event to your friends and loved ones who may benefit from these insights shared tonight. Without further ado, I'd like to let you know that we will be having what we call AMA or Ask Me Anything portion. So please feel free to drop your questions on the comment section. So leading our discussion tonight are distinguished health experts. And first off, I'd like to introduce a successful entrepreneur who is also a seasoned international speaker from a wide range of topics, from personal success to healthcare, our CEO of Simply Nature and founding director of Simply Nature International and PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Sir Shyan.
Good evening, Sheila. Good evening to everyone. So, big welcome to everyone. You know, usually on our program, we have Dr. Johnson, and Dr. Johnson and I often talk about combination. That means natural lifestyle medicine, medical nutrition, and of course, typical, your conventional oncological protocols like chemotherapy and radiation therapy also. But I know a lot of our viewers want to hear, can you treat cancer completely naturally? So we invited Dr. Johann and I interviewed him. And when we say naturally, we really mean naturally. We're not even talking about supplementation. We're not talking about, using alternative or how shall we say, the supplements that you can find in the marketplace. So Dr. Johann in our interview actually shared how by really just transforming your lifestyle and the foods you take, and the only supplements that he took was actually Simply Nature PPARS, because Simply Nature PPARS is just basically plant-based whole food. It's not, it's like your crushed malunggay, right? For those of you in Philippines. So it's really like not any formulation of kind of natural of supplements that you find out there. So Dr. Johann really treated his patients' tongue cancer and lung cancer case completely naturally. So I hope you enjoyed this. This is because many of our viewers wanted to hear about such cases as well. So we bring them, and Dr. Johann, of course, will also share during the interview how he's a medical doctor as well. So for his cases, he would also use conventional if it's necessary. But in these specific cases, he treated them simply by changing their diets and lifestyle. So I'll pass the time back to Sheila. Enjoy tonight's special interview. Very different from our usual discussions together with me and Dr. Johnson. But after this, Dr. Johnson and I will be here to answer all and any of your questions. Thank you, Sheila.
Thank you, Sir Shyan. You definitely made our topic tonight more interesting and exciting. Thank you, Sir Shyan. All right, and now on to our next health expert to present a couple of patient case presentations. He is one of the pioneering lifestyle medicine in the Philippines and founder of the Philippine Organizations of Lifestyle Medicine, registered in 2015. The first international fellow of the American College of Lifestyle Medicine, co-founder and board member of the advisory board member of the Asian Society of Lifestyle Medicine, a diplomat and member of the advisory board of International Board of Lifestyle Medicine. Let's all welcome Dr. Johann Kim Mañez. Let's all watch this.
Hi everyone, welcome to another episode of Simply Healed, and today, by popular demand, we have Dr. Johann joining us. Welcome, Dr. Johann.
Thank you for having me.
Yeah, Dr. Johann has been busy with a new venture that I think many of you, those of you who live in Metro Manila, will be happy to know. It's called Doctor Cuisine.
Yeah, the Doctor's Cuisine.
So what does that do?
So it is basically a nutrition provider. A lot of our patients have been asking us, Doc, what will happen if we don't know how to cook, if we don't know how to prepare the food that is healthy that we should be eating. And so we have a new team of like-minded people, physicians, nurses, coaches that are determined to help these patients. And so we have a subscription for healthy food.
So tonight, it's a very it's great that Dr. Johann is with us, all right, because Dr. Johann actually treats cancer patients with completely natural.
Natural, yes.
But yet, Dr. Johann, you're good friends with Dr. Jimmy Katapia.
Oh yeah.
Yeah,
Absolutely.
Dr. Jimmy Katapia is an oncologist. He uses chemotherapy, immunotherapy, surgery.
I know the limits, because so there are limits. If a tumor, for example, can be resected,
which is to be
which means to be taken away completely.
Yes.
Especially in the very early stages.
Good to do surgery then.
It's good because then now I don't have to worry about the tumor growing, right? It's gone.
So
and then I go on to treat everything naturally.
So again tonight, Dr. Johann will share with us how we can completely, using natural approaches through lifestyle modification, to successfully treat cancer. At the same time, Dr. Johann comes with a background, good friends with Dr. Jimmy Katapia, one of the top oncological surgeons, and a guest on our program as well. In fact, Dr. Johann, Dr. Johnson, and Dr. Jimmy are all doctors of the SMG group. So those of you who want an SMG consult, right? Those of you who want to consult about surgery, ask for Dr. Jimmy Katapia. Those of you who want to go integrative medicine, a mix of conventional and non-conventional medicine, Dr. Johnson is the doctor for you. And those of you whom I know there are many who will really just want a natural approach, maybe because you're 68 years old and you don't want to go for surgery, or for one reason or another you can't avail chemotherapy and you want a totally natural approach, that's Dr. Johann for you. So Dr. Johann, you really only use lifestyle medicine, lifestyle approaches through diets and the way you live to treat cancer.
Yes, as much as possible. If we're talking about my practice, absolutely. But the thing is, we collaborate with other doctors as well.
So when it comes to things like, so you do understand the time and place for surgery.
That's right.
Then that's when you will work with our good friend Dr. Jimmy Katapia.
Our colleagues.
Yeah, colleagues. So guys, this is great. Those of you who want to go for a natural approach, you still need a safety net. You got to make sure that even though you're going through your natural protocols, your doctor is also connected to doctors who are using conventional, and they know when you have to use conventional methods as well. So that's great. Doc, I want to ask, what's your success rate with cancer patients?
I don't want to brag.
Okay.
But if you look at all my files and the successes that we've had, I would say it would range between 60 to 80% success.
60 to 80%. Wow. And are these only stage 1, stage 2, or do you also include
we have had stage 3, stage 4 cancer patients as well. Yeah.
Okay, so I'm sure you're pretty excited to know what Doc Johann does. And Doc, why don't we take this opportunity to look at a few case studies?
Sure.
Yeah, so we'll start with the first one. What is this patient?
Ones.
Yeah, one of the more recent ones.
Okay, so this patient is a 33-year-old male, at least during the time that I met him. And it was him who approached me with his wife, right? So he had lung cancer.
Wow, small cell or large cell?
It was not determined because he didn't want biopsy.
Okay, so that's again, there are many of you out there who don't want to do biopsy, right? And then if Dr. Johnson is here today, he'll tell you, go for your biopsy.
Yeah.
But if you're obstinate and you really don't want, and there's something that you really don't want to do, then
we respect that.
We respect that. And Dr. Johnson will tell you, go and see Dr. Johann. So Dr. Johann, what did you do with this patient since he didn't want to do it?
So we do know it's either, there's only basically those two, right?
Yeah.
Small cell, non-small cell. So we treated it as a cancer patient with lung cancer. And again, the approach is to give them a whole food, plant-based diet, apply all the principles of lifestyle medicine. There are 6 pillars of lifestyle medicine.
Okay.
So we applied all of those pillars, made sure he exercised well, he slept well, he had less stress, didn't smoke, didn't drink alcohol, all the basics in terms of a healthy lifestyle. And then, of course, to speed up the process of healing and dial down the inflammation, I used Simply Nature's PPARS. So we used the liquid and the tablets.
Wow. Okay.
Together. The tablets because they're whole food. Okay, and the liquid won't work as well if it's just on its.
Yeah.
on its own.
You
So we
still need the
combine it.
fuel,
Yeah.
the combination.
So we combine it so that there's a substrate for the metabolism or the use of the PPARS. So that's what we did.
And what happened to the patient?
The thing is, we do have enough research that we know that PPARS, it comes from chlorella, right? So we do know that lung cancer is specifically benefited by PPARS.
Yeah.
So we do have all these studies.
In fact, we have the studies to back that up.
Yeah.
In fact, the lung cancer cells undergo apoptosis. That means they die off on their own. So what happened to this patient?
This guy had difficulty of breathing.
Couldn't,
Right?
difficult.
He couldn't inhale properly without coughing
Okay.
because there were 3 masses.
Okay.
And this was detected through CT scan and through X-ray, right? So we saw it. And so this is this is like a miracle. To me, it's short of a miracle, right? But I know there's some scientific explanation.
Yes.
But to me, it was short of a miracle because we have a 10-day cancer siege program that I put my patients on, my cancer patients. It's a residential program. So they stayed in the facility. And of course, we had all these previous laboratories. And so there was one point in the program where the patient was, and he was already on PPARS, he was already on the
liquid and everything.
Yeah, the lifestyle medicine approach, all the pillars. He was doing that for about a month before we started the 10-day program.
All right.
Because it was the 10-day program was like an intensive educational phase where we teach everything at the same time he experiences everything. And so there was one point when he was doing his exercise where he was out of breath. He's like, what's happening to me? He was so out of breath. So he was rushed to the emergency room of the closest hospital. And this is where the miracle happened.
Yeah.
Okay.
He coughed out something?
Nope.
Okay.
He got an X-ray. And then the X-ray technician said, what's your problem again with the lungs?
Because there was no more masses.
No tumors.
No more tumors.
How can 3 tumors disappear in a month and a half or so?
A month and a half. Wow.
So I couldn't explain that at all. And then so we said, are you sure that this is your X-ray slide? It could, there's so many people with X-ray slides in a hospital. By accident, he could have flicked through the wrong one, right? I was looking at the wrong.
Yeah.
So we verified. I went and checked, and there was no tumors. And so he said, the diagnosis was hyperventilation. He was simply breathing too fast.
Oh, wow. From
And
not
so
being
they
able
had-
to breathe
yeah.
properly to breathing too fast.
And so they had to give him some carbon
So
dioxide.
slow him
Give him a
down.
brown bag so that he would start to breathe a little bit of carbon dioxide and normalize his breathing rate. And so the thing is, it was he had his wife, right? So I'm skipping a bit here, but he had his wife with him, and during his program, his wife showed me her tongue.
Okay. In Chinese medicine, tongue diagnosis is actually very important. You can see a lot of things.
This is something else.
Oh, tongue cancer.
Exactly.
Oh, wow.
I've had patients with tongue cancer, so I know exactly how tongue cancer looks like.
I just want to say something, Doc. It's no surprise that if the husband has cancer, the wife has cancer.
Because they probably have the same
yeah,
lifestyle.
you live together, you eat the same thing, you end up with similar diseases. All right, so...
Okay, so I looked at her tongue. She just, she said she'd had it for a few months now.
And is this the picture of the tongue? Is this her tongue?
Exactly.
That's the one. Okay, so wow,
Okay.
it's
So it's not a very pretty sight.
No, it's not a pretty sight.
There's I don't even want to mention, but yeah, literally there was pus. There was
Wow.
the center was black because
Wow.
of the tumor. I said, this is tongue cancer. we have to get this checked. And since it was an open wound, biopsy was okay.
Okay, yeah,
Right.
might as well. Just
Might as well.
take-
It's a wound.
Yeah.
So, got the biopsy immediately. I think it was the third or fourth day of the husband's program. I asked her to get the biopsy, and lo and behold, it was tongue cancer. I mean, what do you expect, right?
What stage at that time?
It was still localized. which is
Localized, so
good.
stage 1, stage 2. Stage 2.
One, stage. Actually, it was. I think the doctor said it
2,
must
3?
be 2.
Yeah, 2.
Because there
Definitely
were-
2.
yeah,
Yeah, look at it, it's,
Yeah.
it's definitely 2.
So, what happened was instead of one patient, I now had
2 patients. So what happened to her?
So this is what happened. So again, remember the guy had no more.
Yeah, he's okay.
Right.
Yeah.
And I showed you the.
So she must be
before
very
and after.
confident because of her husband's
Of what happened.
miraculous case. So
Yeah.
she's like, Doc, tell me what to do for mine, right? Yeah.
So since she already knew what her husband was doing,
Okay.
I just told her, well,
Do
you
the
might as
same
well
thing.
Adapt everything.
Yeah.
So she changed her diet completely.
Mm-hmm.
Completely plant-based, whole food diet, no cheating. I
Wow.
mean, what's the point, right? You have cheat days, you cheat yourself.
Yeah.
What's the point, right? So I told her, you have to start immediately because your tongue cancer looks way worse than what we just found out with
Yeah.
about her husband.
Just take a look at the picture again.
Yeah.
Wow. Wow.
And so that happened. And then I think it was like 2 or 3 months. There's the dates, right?
Yeah. August. No, it started in May.
Yeah, May,
June,
and then we
July,
have
August. 4
So-
months.
So 4 months. So August came. So
Wow.
she basically started the whole thing, and she went on her own 10-day program.
Okay.
That's how dedicated she was
Wow.
in following all the principles that healed her husband. And so she goes through the program, takes the PPARS just as I ordered.
Yeah.
Okay, she knew the benefit of it. And lo and behold, 4 months later, she comes back and she says, Doc, this is now my tongue.
Wow, you can see in the picture.
There was
4
no more
months.
pus.
No more pus.
The wound was very small.
Uh-huh.
And as you can see, it's so nice and pink now. It's not black and...
Wow, this is
ugly.
amazing. Was she on any drugs at all?
No other drugs. No
Even
other
anti-inflammatories?
No.
None?
She was...
Not even painkillers? I mean, it's really painful.
Yeah. So initially, of course, there was some pain. I said, you don't need to suffer.
Uh-huh.
So I'm okay with that. I'm a lifestyle medicine physician, but I'm still a doctor.
You're still
right?
MD. So
I'm still a regular
you
doctor.
told her she can take
She can
paracetamol,
take
painkillers.
I think it was tramadol that she
Okay.
took, or mefenamic acid. I can't even remember the details anymore. But she took 2 painkillers
All right.
just to help with the pain initially.
I'm
But
sure.
then later on, like a few weeks into the program, she said, Doc, I'm taking the painkillers as needed. I noticed that I'm not taking painkillers anymore. That means it's tolerable now.
Wow. Just a few weeks.
Just a few weeks.
Wow.
And so the rest of the months that followed, she wasn't even taking painkillers
Okay.
because the inflammation had dialed down very quickly,
Okay.
as expected because of the PPARS. And so I was just really elated to find out that now she goes to her church and tells everybody about her blessing. She's saying, this is what happened to me. I just followed the protocol, a plant-based whole food diet, exercised, had vitamin D from natural sunlight, all of that, plus PPARS, and she got better.
So, Doc, it seems like your protocol, your natural protocol, is a protocol that fits multiple types of cancer.
Yes, that's because when we talk about nutrition in particular, we know that one anti-cancer vegetable, for example,
Yeah.
which they tested,
Which will work for almost all types of cancer.
absolutely, that is the exciting part. So it's not like one.
It's not like chemotherapy.
Specific for
yeah,
breast
you're
cancers,
specific
yeah.
for, even in breast cancer, there is 4 types, right?
Yeah.
And each type is different types of
Yes.
medicine.
So you need a chemotherapeutic agent specific to the mechanism of how
Yeah.
that cancer, or the pathology of that cancer. So the beauty about food as medicine is that there's multiple pathways. There's multiple ways. Let me just make it simple for everyone to understand. There's many ways that cancer can be produced.
Okay.
And the beauty is with these plant food that we eat, it blocks all the possible ways.
Yes, Doc Johnson was talking about this.
I
That
was
like
pretty surprised.
10 pathways or 10 hallmarks of cancer.
Right, there you go.
The 10 hallmarks of cancer. And that's how chemotherapy drugs work also. Every chemotherapy drug approaches a different hallmark, a different road to the cancer, and it tries to block them off. So what you're saying is that under your care, you will modify a patient's diet to the point that the food that they take actually block all the 10 different pathways.
And they're just eating that food. And they're enjoying it, by the way, because it does taste good.
I think, you know, there are many times our viewers always ask us also, is there any anti-cancer formula? And I think this is it, right?
Yeah.
If you eat foods that block the pathway or the hallmarks to cancer, you are essentially being anti-cancer
What you're
on
doing
a daily basis.
What you're doing is you're starving the cancer, basically.
Wow.
Preventing it from taking hold and, you know, spreading throughout your body. And
Doc-
that's why we're successful.
I think people want to ask a lot of questions now, but before we go to our AMA segment, there's one last patient that you want to share.
Okay, so this patient was very interesting. He's a 70-year-old male.
70-year-old. So, Doc, sorry to interrupt. This makes a lot of sense. I know there are many of our viewers out there. A lot of cancer patients are actually our elders, right? And I can totally understand if you are a senior citizen.
Skeptical about.
Yeah, you might. The question might be: is it worth it to go for a major surgery? Is it worth it to go for chemotherapy? And if you have those fears, I would still encourage you. You know, my encouragement is for cancer, do every approach that you can do. So just as Doc Johann had said, if you're in the early stage and it can be redacted or layman term to be cut out, cut it out, right? And then after that, you have peace of mind to treat the rest of your cancer recovery naturally.
Yes, absolutely.
Right. So again, this is a perfect example where a person would, and even the kids would support trying a natural approach instead of purely just conventional. So what happened with this patient?
Okay, so this patient comes to me. He says he came from the urologist.
Urologist, all right.
And the urologist was, of course, wanting him to get some surgery done. But he said, I'm old. You know, I don't want exactly what you said a while ago.
He's old, all right? So this does not necessarily apply to young people, right? So
he's old and said, if I do surgery, will I still be able to pee properly? You know, all these
Good question.
all these concerns. And of course, the surgeon can't say 100% you're going to be able to pee properly because
I think this
we never know, right?
Doc, this is great because it's true. We have another patient. Her name is Nesta. She's actually a worship leader in my church.
Oh, okay.
So she had nodules on her throat.
Right. Thyroid problems?
No, just nodules. Just nodules.
Okay.
Not cancerous, just nodules. All right. And but it was affecting her voice. She lost her voice.
Oh, no.
And then she saw 5 throat specialists, ENT specialists, right? And every one of them were very hesitant. But they all said the same thing. They are pretty confident that she will not be able to sing the way she sings if she operates.
Well, I mean, it's an operation, right? You can
Right.
never tell the outcome.
So, I mean, it's in line with what you said. The 70-year-old man will be worried.
Will he be able to pee again?
Will he be able to pee again?
Properly, yeah.
But what
At
happens
least
to him?
control his pee. That's actually the major issue. You know,
Yeah.
after surgery, you might not be able to control your pee.
Wow.
So they end up either with catheters or diapers, which is very uncomfortable.
And not only that, honestly, as a guy, if we can't control our pee, I think it affects our sense of dignity. Yeah, it's something that is actually pretty important. Yeah.
And so I did understand his concern. I said, okay, since it is your choice, you know, I never force anything.
So was it cancer? Right? I mean, was it diagnosed as cancer already?
Prostate cancer. His
prostate.
PSA was up in the kind of the cancer range, if you want to put it that way.
Okay.
And of course, his imaging, there were calcifications, so you know, even more evidence that it must be some kind of cancer, starting prostate cancer. And so he said, okay, let's put you on the program.
And
again with the PPARS and the liquid in the tablets. And as you can see here, initially, his result was up in the abnormal range.
Okay.
Normal is like until 3 or 4.
Wow.
And his is like double or
Yeah,
triple, right?
8.56.
Yeah, so it's double the normal.
Yeah.
Okay, that's quite high. And so I said, okay, I'm going to undergo your program just because I'm scared of the knife.
Okay.
And so he undergoes the program. If you can see here the information, 8.86.
Wow. Oh,
milligrams per
8.86,
ml.
sorry,
That was
yeah.
April 14,
April 14.
2023.
Of this recently.
Yeah, just last year.
Just last year.
And so after April, May, June, after 2 months, he comes back. His PSA is now 6.04.
2 months. That's very fast.
2 months.
And for everybody out there, prostate cancer is one of the slowest growing
it's
cancer.
It's a very slow growing cancer.
So those of you who have prostate cancer, opting to go natural is actually very viable.
Yes, absolutely.
Right? It's not so risky like some aggressive cancers. Other aggressive cancers, I'm sure even Dr. Johann will encourage you to go for chemotherapy, especially if you are still young and fit, right?
Yeah.
But prostate cancer, good candidate for natural therapy.
In fact, one of the father of lifestyle medicine, Dr. Dean Ornish, that was one of the cancers, the first cancers he discovered that is completely reversible through lifestyle management.
So I think prostate cancer is something very common to a lot of males.
Of course.
Females
don't have prostates, so
yeah, I'm turning 50 this year. I have to get a prostate exam, but I don't think I'll look for you or Dr. Johnson. It's just weird having your friends do your prostate exam.
Right.
All right.
Okay, so this is what happened. It decreased, by almost 3 points. If you look at the numbers,
yes,
okay? It's close to 9, and now it's 6.04. It's still high PSA.
All right.
But he was determined, and he kept at it because he was inspired that it decreased.
Yeah.
Just after 2
2
months.
months.
Okay?
Yes.
And so this was his
third one.
Results. August 25, 2023.
June, July, August. Another 2 more months. Normal. Wow, from 8.86 to 1.73.
No, this is absolutely normal.
Wow. Absolutely. And this is
and this is low normal.
And this is 70-year-old man.
70-year-old male.
And we all know as we grow older, it's harder for us to go back to normal anything, right?
That's right.
Yeah, not just when we have a tumor.
So this was not just exciting for him. It verified, it validated what I already know about prostate cancer and how it is reversible through a healthy lifestyle. Plus, we have now an absolutely great product, which is, by the way, whole food as well. So it's completely in line with lifestyle medicine, where we encourage eating whole plant-based foods. And so this is what happened. We were very successful in a short period of time.
Absolutely wonderful. And I think this is one wonderful thing. You, Dr. Johnson, and Dr. Jimmy Katapia work together as a team in SMG Consult. So SNI is very happy to work with SMG Consult doctors. And for those of you out there, every time a patient wants to do naturally, their surgeon will say something, and even their integrative doctor will say something. But now your colleagues in SMG Consult are actually...
That's because they see the evidence. It's really a matter of explaining. Some physicians may be a bit wary about, because they don't know. They don't know what you're doing. It's a new field of medicine. They've never heard of it probably. And so they're skeptical. I understand that completely. But we have here physicians who don't just, they're skeptical and then they suddenly become prejudiced. I don't like that. We have to be skeptical at anything, but then we have to do our research. And once they did their research, they found out that,
it works.
It does work.
It does
and it actually helps their patients, because we're a team now and we're approaching this holistically. We have the nutrition, the lifestyle, and then if they need chemotherapy, surgery,
we have Dr. Jimmy Katapia, and if you want to do other modalities like vitamin C drip and everything, Dr. Johnson is very as an expert in that area. So I can see the questions are popping out. I think, Doc, because
we'll give them time.
Doc, on our program, right? We are so happy to have you on, because normally we really do take the everything approach, right? Not everything that works approach. But I know many viewers out there, for personal reasons and some very real reasons, such as being an elderly, you want to avoid certain protocols like surgery and chemotherapy and and any of the more like radiation therapy. So you have valid reasons for choosing that approach. I would say that make a consult directly with Dr. Johann. Now, if that's you, make a consult with Dr. Johann. Why? Because Dr. Johann works together with Dr. Johnson and Dr. Jimmy Katapia, so you are also supported. So if you do need the conventional intervention,
I will absolutely refer you to Dr. Jimmy.
So here you are. You're going to do natural with a safety net. You have the support of the conventional doctors out there. So for those of you who are children and your loved one wants to insist on doing natural before trying chemo, I can't endorse anyone better, especially when Dr. Johann works together with Dr. Jimmy Katapia and Dr. Johnson, because you know, as your loved one tries the natural, if there needs to be a shift to the conventional, Dr. Johann has his teammates ready to start those protocols. So I think it's the best of every world, Doc. You know,
I mean, that's what we really want to do for our patients, is to give you the best of everything and to make sure that you have the options. I mean, if you have a certain belief, you want to keep with that belief, then we have options that can protect that belief. You don't have to go, against your conscience and do something you completely don't want. We have everything covered.
And yet you have the full confidence, especially those around you, right, who are skeptical. I'm sure you have family members that say, no, go for surgery, go for chemo. At least you can tell them, as I do my natural, my doctor works with oncological surgeon supporting him. So if anything does not go according to plan, you are well taken care of. Dr. Johann, thank you for joining us today. And as we can see, lots and lots of questions. I hope you'll be able to join us in the AMA segment.
Sure. I'll make myself available.
So let's go ahead with the Ask Me Anything portion of our program tonight.
Sure that you have learned so much from the discussion made by Dr. Manyas and of course Sir Shyan Lim. Those very interesting patient case presentations, right? I hope you got encouraged with those as well. So we are now in what we call AMA or Ask Me Anything portion. Take advantage of this, share this event to your fellow loved ones and patients in your hospitals, okay? So at this point, to answer all our questions in this modern world filled with noise and different health opinions, trust the ones from the experts. Let's call on once again the founding director of Simply Nature International and PPARS expert from Singapore, Mr. Shyan Lim. And to join him in answering our questions for tonight, let me introduce our next health expert. He is a graduate from St. Luke's Medical Center, College of Medicine, and he is a diplomat of International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. He is also a medical consultant at Simply Health Medical Group and a consultant at Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center, Las Piñas, where he manages patients with cancer and metabolic illness. We all miss him, Dr. Jansen Tan-Kalala. Good evening, Sir Shyan, and good evening, Dr. Jansen.
Good evening, Sheila. Good evening, Doc.
Hi, good evening to you. Happy to be here again.
Yeah, we missed you. You did one episode without me, and I did one episode without you. Yeah. This show really belongs to the both of us. We've been doing it for 3 years. Oh my goodness.
Wow. Been 3 years. Wow, that long, huh?
Yeah, that long.
Just to let you know, Doc and Sir Shyan, we are now at our 159th episode. So thank you guys for always watching.
159. Wow. Wow. It's amazing. It's amazing. Thank you to everyone, all our viewers. Thank you very much for still being here with us. So let's go to your questions tonight.
Excellent. All right. Well, for our first question for tonight, coming from Ms. Maria Cristina Pamarato from Davao, my aunt died of colon cancer. I want to know what are the things that I and my family need to avoid to avoid or not inherit this history of cancer that we have in our family? Very good.
Perfect for you, Doc.
Okay, it's a really very good question because if you have a family member who died of, of any kind of cancer, no, you'd be worried yourself. But
Yes.
here's the thing, no, it's your aunt, so it's kind of a far relative already. What you have to worry is no, if it is within your immediate family. So by immediate, that means your mom and dad, your grandparents. Okay. If so, then I would be worried. Yeah. Okay. But if it's your aunt, no, colon cancer, if you really want to be vigilant about it, you have to find out at what age was she first diagnosed with colorectal cancer. Subtract 10 years from that age, that is the age when you have to start screening for colorectal cancer by way of colonoscopy, your FIT test. That the FIT test is a fecal immuno it's a fecal immunostaining test, no? It detects for antibodies found in your stool. So it's a high-tech method of detecting or to screen for colorectal cancer. Much more advanced compared to the FOBT. The FOBT test is the fecal occult blood test, no, wherein we just detect blood in your stool. However, for the FOBT, there are a lot of things that can contribute to the presence of blood in your stool. So don't be afraid of the result no, immediately, because there are a lot of things that can contribute no, that can cause the presence of blood to occur in your stool. So that can be as simple as an anal fissure, okay, because of a very large stool that passed out. Okay, so which is of course non-cancerous and benign. But definitely, if some of those tests come out positive, like FIT and the FOBT, right, then that warrants further consult for follow up with your doctor. So your doctor has to chase that or where it's coming from. Okay, so but just to have a general guide, though, you can just do the colonoscopy. You can do it 10 years earlier from the time that your aunt was diagnosed with colorectal cancer.
All right. On my part, I think the key thing that Dr. Johnson said is that colonoscopy, which is done usually for normally we do it at age 50. I mean, I know that's for prostate cancer.
Yes.
So colonoscopy also the
same.
So if you have it in your family, then you can opt to do it 10 years before. And the reason is very simple, everybody. If you catch your cancer early in the stage 1, stage 2, and I think this viewer is just being very wise, it's in your family's DNA. So why not, right? Now, if you catch it early, most cancers, even very difficult cancers, are very treatable. That means your success rate is often in the region of 70% and up. And for many cancers today, it's like 85, 90% and up if you catch it in the very early stages. So it's a good strategy. So Dr. Johnson suggested some diagnostic. I'm going to suggest another one that I'm sure is going to be related to some questions that will come later, which is, what can you do that's anti-cancer? People always ask, how do I be anti-cancer? So the answer to anti-cancer is actually a very broad spectrum. I think what you want to hear from many of our viewers is that you want to hear a specific thing that will help reduce your chance of getting cancer. The answer is be healthy, all right? If you don't have metabolic syndrome, so if you don't have high blood cholesterol, high blood sugar, if you don't have hypertension, if you don't have chronic inflammation, I think these 4 things will already eliminate your chances of, not eliminate, greatly reduce the likelihood of you developing cancer. So to be anti-cancer is to manage your inflammation and your metabolic syndromes. So those are the basis of developing cancer, okay? So instead of being anti-cancer, what you want to do is to make sure that you are not chronically inflamed, that your blood sugar level, blood cholesterol levels are good, you have a healthy lifestyle, and then you are pretty much anti-cancer. All right. So one thing you can do on our part is supplementation. Number one, Dr. Johnson always talk about eating and living right. However, we do live in a modern day society, so sometimes it's not easy. Dr. Johnson and I have a favorite restaurant if we want to eat vegetable. There's Putian. Every vegetable dish there is beautiful and delicious. But you know, it's not easy. Not everybody has a ready source of place where you can eat wonderful vegetables, right? So supplementation becomes just a practical strategy. So I will recommend PPAR tablets because that's one of your best basic foundation. It helps you modulate or manage your chronic inflammation, blood sugar, blood cholesterol, your metabolic syndromes. So that in itself will keep you anti-cancer.
Thank you, sir. Thank you, Sir Shyan, and thank you, Doctor. This is a very good question because a lot of not only that our patients are watching, but also their relatives. So this is very applicable to them. Next question.
Well, sorry, one last thing. Dr. Johnson always shares this, and I remember. He says that a family that eats together gets sick together. So so the fact that it's your aunt, most likely you're not living the same lifestyle as your aunt unless you're living together with her. So that's another reason why your chances of getting cancer is you don't have to worry yourself. Sorry, Sheila, I saw a question by Nexi J. Toilo. I don't know if I'm pronouncing your name correctly or I'm butchering it. If I am, then I apologize. Right, this question is directly related to what I said. She said, is PPARS, can it reverse DM2? I assume you're talking about diabetes mellitus 2, right? Type 2 diabetes. Can it reverse it? The answer is yes. Right, the short answer is yes. If your diabetes is on the moderate side, I think just PPAR tablets alone will be fine. I would recommend, since it's for therapeutic, within a month, it will improve, right? And usually within 3 months, you should be absolutely fine. Now, if you want, I will also recommend that you have a consult with Dr. Johnson, especially if you're on medication, so that he can guide you through the process of how to manage your medication together with the PPAR tablets. Because we don't recommend people just dropping their medication like that. I think that's pretty irresponsible because I don't know how serious your diabetes is and whether you're taking the right dosage of PPAR tablets to make up for dropping the drugs so drastically. So usually we will ask you to gradually taper off your maintenance medicine over a period of 3 months, and then you should be able to be totally free. Okay, you should be able to reverse your condition and be free from diabetes. Okay, but you've got to watch what you eat. You can't drink 2 huge big gulps every day and think that you can keep diabetes away. You still got to modify your diet to be a healthy one. Thank you.
Thank you, Sir Shyan. Okay, and this is an interesting question coming from Ms. Jhen Chan Ang. How many calories or carbohydrates does PPARS tablets have? Does taking it can interfere the fasting mode during fasting hours of a consumer?
Okay, I can answer this question. The answer is it's negligible. All right. Number one, because if you take even 20 micro tablets, that is literally 2 grams, right? 4 grams, sorry. 4 grams of algae. That's even by weight, the calories is limited. All right. So don't worry about it. The calories is negligible. Now, I have taken PPAR tablets as a meal replacement before. So when I take it as a meal replacement, let's say I'm on severe fasting, I don't fast. But for example, if I'm speaking at a conference. When I'm speaking at a conference, I try not to eat before I speak because, when you eat, you get drowsy. So I need to stay alert. So during these times, I actually fast. I fast from normal food. I actually take PPAR tablets as a replacement. How many tablets do I take? In excess of 30 to 50, right? And even then, it just gives me the nutrients, right? It gives me the nutrients. I usually will still take a drink like a hot chocolate or whatever to give me the calories. But it does give me the vitamins and minerals and, it does give me calories as well. But you can see, obviously, it does not, the calorie content is not high enough to make a difference to your fasting. In fact, it's probably the best way to support your fasting, because when you're fasting, your body still needs the key, shall we say, minerals and vitamins. And since it's not calories, usually main reason why people fast is to remove the intake of sugar, right? So that your blood sugar levels will be natural if you're going to do for CBC, right? Fasting sugar levels. So that's the main cause, but you still need actually your vitamins and minerals and all those nutrients to function properly. So actually, tablets are actually great assistance when you're doing fasting. Yeah. Sheila, you're muted.
Sorry.
Yeah.
All right, Sir Shyan, you mentioned a while ago that you use PPARS tablet as replacement for your meal, right? So this mean that our PPARS tablet can be used by those people who are always in a hurry in the morning, always forgets to get their breakfast or to take their breakfast?
No, absolutely, absolutely. But definitely if you're going to use it as a meal replacement, then the quantity you have to take at one shot cannot be just like 5 or 10 micro tablets, right? Because 10 micro tablets is 2 grams. Okay. Yes, our PPAR tablets is superfood, but can you imagine 2 grams? If you eat 2 grams of rice, that's like half a teaspoon of rice, right? No matter how powerful half a teaspoon of rice is not going to give you enough energy to last throughout the day. So if you're really thinking of it like a replacing an entire meal for, then I will take at least 30 to 40 micro tablets. So it's like you're taking a significant amount. It's like you eat a banana, right? It has to be a certain size. If you have a small banana, it won't keep you running. So yes, it can be used as a very effective meal replacement, especially or meals or supplemental support when you are on fasting. So a good combination would be energy drink, as in when I say energy drink, I don't mean Red Bull and sugar-filled drink. I think maybe you take an oat drink or a cereal drink, or even hot chocolate if it's something more commercial, right? And then or soya bean milk, right? Or almond milk, oat milk, and then with the supplements. I think that's a great combination to support yourself if you are not able to eat a regular meal. Yeah.
Thank you, Sir Shyan. All right. So for our next question, coming from Ms. Girly Umali from Taytay, my mom has lung cancer, stage 4, after 5 sessions of chemo and now under targeted therapy. Will it be possible for her to be cancer-free?
Let me see. What's the question again?
One more time.
Yep.
My mom has lung cancer, stage 4, after 5 sessions of chemo and now under targeted therapy. Will it be possible for her to be cancer-free?
Very difficult because this is stage 4 lung cancer. However, with targeted therapy, I've seen much success compared to just chemotherapy, okay? Because the side effects of targeted therapy, especially the tyrosine kinase inhibitors, that's the classification of the medication, no? They're more manageable compared to just plain chemotherapy, okay? However, being stage 4, it's gonna be very difficult to fight off, no? To kill the cancer cells totally. So definitely you would have to have other treatment in conjunction with the targeted therapy that you are receiving now. But make sure they don't have any interactions. Okay, so you have to ask your doctors, consult with them. Okay, but to answer your question, it's very difficult to be cancer free at this point because it is stage 4 already.
I want to add that it is difficult to be cancer free, but it doesn't mean that you cannot live a full and effective life. So I think that's also something I would like to highlight, because especially at the age of 70, right? What the focus of when I meet patients that are 70 years old, I often ask the children, what do you really want for your parents? Do you want them to be cancer-free, or do you want them to live out the rest of their life full of energy, being able to enjoy life, So, I mean, you could actually fight a long battle with cancer, which means like the cancer actually, the battle actually lasts quite a few years, 6-7 years is also possible. But or if it's shorter, three years, we don't know how long, depending on each individual case. But what you want for a 70-year-old is to make sure that, can you imagine if your parents are a 70-year-old fighting lung cancer, going through the process where every day not being able to stay awake, always very tired, in pain, then I guarantee you, if you see your parents going through that, after 1 year of seeing them go through that, a thought might enter your mind to say, maybe they're suffering so much, it's better not to fight. These are thoughts that will come in when we see our loved ones fighting. Dr. Johnson, my cousin is a thoracic surgeon, right? So normally in Singapore, if you are 90 years old, they actually don't want to treat you. They say you're wasting the hospital bed. Yes. And then because of my cousin, my grandma was able to stay in ICU a bit longer because he's an important doctor and surgeon in the hospital, right? So, but when my grandma was she had a tube stuffed down her throat. She had iron lungs. The machine was helping her breathe. After 1 month of that, my cousin, I was not there personally, but my sister told me she saw like my cousin tear. Right, he just saw this grandma whom he loved so much, our grandma, really suffering, and he was the one who said, let's stop all this ICU treatment. Okay, so I think the focus here, instead of asking the question, maybe let's straight away focus on one thing. It's a mom, right? If I'm not wrong, did he say mom?
Mm-hmm.
Sheila is
yes,
mom, right?
correct. Along
I think the first thing the straight focus you can do is, let's focus to give your mom lots of strength. She's very energetic and she moves and behaves as if she doesn't have cancer. That might be something which is a worthwhile pursuing. So with that, I would definitely recommend that you go for a consult with Dr. Johnson. All right, there are many there are treatments and protocols he can try, all right, to see if it will give your mom that quality of life, that strength, that focus. Doc, I remember you had one patient who was bedridden, 70-plus-year-old man with 4th stage lung cancer.
Yeah,
and
I
then
remember him,
yeah, and then straight away after less than 2 weeks, he was being able to sit up, and with assistance from his yaya was able to walk around on a cane or something like that, right?
Yeah. Mm-hmm.
Yeah, so I think that's a better. Yeah, that's a better focus, and that's something that's achievable. If you want to know how to do that, on my part, I'll tell you, take Simply Nature liquid PPARS for the details on dosages and how to match that with food and other supplements. And I think Dr. Johnson will even explore other integrative approaches from ozone to vitamin C drips, all right, to be able to give a quality of life. I think that is the most important. It doesn't matter at a certain age, it doesn't matter if you beat cancer. What is important is if you can live life as if the cancer is not there. I think that will be a lot more impactful and more helpful for your mom.
Thank you, Sir Shyan. All right, next question. I think the question is out of curiosity because question coming from Jo Marie. If I have tongue surgery, will it grow back?
No. If you cut off your tongue, the tongue is a muscle. If you cut it off, it won't grow back. It's not the same as the liver. The liver can grow back.
It's only the liver that grows back, right, Doc? I think out of the whole body, is only the liver as an organ, the only one, except for skin. I know our skin is an organ, but
skin, yes, correct. Skin can grow back. Your liver can grow back, but I think in the internal, your internal organs, the liver grows back. I'm thinking of another organ system that can grow back.
Yeah, I can't think of any other organ that can grow back. I can think of organs repairing themselves, but to grow back is a totally different.
Yeah. It's only the liver, I think. Yeah, because when you cut off one lobe of the liver, it grows back. Yeah.
Yeah, I have a friend who had half his liver removed. Half. It grew back in 6 months. So that's how amazing it is. It's like Wolverine. So just for those of you, but then again, liver cirrhosis is a different issue. So you don't abuse your liver, but your liver is actually capable of regenerating. All right.
Thank you, Sir
So
Khan.
no, the tongue no.
Sorry.
I saw this one, Felipe Palmo. All right, this is Felipe, and she says she's based in Sydney, Australia. Got out of the hospital. Doc, I think this one should consult with you, but I know we can help her. Got out of the hospital earlier today after doctors administered biopsy, told her that she has a malignant mass in her pancreas and decided not to progress with surgery. I'm not sure what you have to say about that. Instead, she will undergo chemotherapy, which she will proceed only after she regains strength and proper weight. So, Doc, this for Felipe, is it correct? Felipe, or is it Philip?
Felipe Elmo.
Yeah, Felipe, right? Number one, go for a consult with Dr. Johnson, all right? So here's the good news. Okay, here's the good news. Because I know you want to undergo chemotherapy, let me give you the good news. Okay. I'm sure Dr. Johnson will prescribe you liquid PPARS, all right? That's going to very quickly get you ready for chemotherapy. Okay, it will increase your red blood cell count, white blood cell count, and maintain your red blood cell count, white blood cell count while you're undergoing chemotherapy, which is very important. For myself, the most extreme case of a client and patient that I've heard of was that the patient cannot go for chemotherapy because the patient was too weak, right? She took liquid PPARS, and within a month, what was impossible became possible. The uncle was then saying, oh, you are eligible for chemotherapy now. So for your direct condition, I will let you know now, the PPARS extract together with the tablets will get you where you want to go, okay? Now, on top of that, because you want to gain strength, I think a consult with Dr. Johnson would be great for you because he'll give you lots of advice and direction on how you can strengthen yourself. And the good news is you're in Australia. You just have to trouble Dr. Johnson to match your time zone. So, Doc, this will be either a very early or very late consult. Actually, not so bad. Their time difference is not so bad. All right. So you can do a teleconsult with Dr. Johnson, and we can get the products to you even in Australia. Just liaise with our logistics department. So that is good news. Great that you're with our program today. You have found a solution. Dr. Johnson, you want to say something about this?
Yeah, we can definitely help with your chemotherapy, some supportive treatment, no? But I have to really talk to you so I can make the appropriate recommendations. And just to add, I think it would be better for you to consult with one of the lecturers that went here in the Philippines. He's an Australian. His name is Dr. Ashley Berry. So I think it would be good for you to consult with him. He's an integrative medicine doctor as well, but he's based in New South Wales. I just don't know if he has a clinic in Sydney. So just do your research on him, where he practices. But it would be really good if you can talk to him as well.
And I also noticed this, Felipe is also diabetic for 20 years. So good news, you've heard how effective our protocols are for diabetes. So not only will it get you ready for your chemotherapy, it will also manage your blood sugar levels. So it's all good news for you on the program today. Sheila.
All right. Thank you, Sir Shyan. All right. For those of you who wish to have a consult with Dr. Johnson Tangkalalan, please just type in how to Hi, can you hear me? Okay.
Yes.
All right. Okay, for those of you who wish to have a consult with Dr. Johnson Tangkalalan, just type in how to consult, or the link for you to to book a consult with Dr. Johnson is in the description box or on the comment section as well. All right. For our next question, coming from Ms. Ginalyn Jacobe, how do I know if my lungs are healthy? I think she's asking for modalities or ways to know apart from X-ray.
How do you know if your lungs
you can't. Well, you can't really know if your lungs are healthy or not based just on an X-ray, no. But definitely you can know if your lungs are if you have lung disease, no, based on X-ray. Okay. One tip that you can One test that you can do is the pulmonary function test. So the pulmonary function test is a test wherein you do spirometry. So spirometry is a test to know how much your lung capacity is. If there are any difficulty in breathing, shortness of breath, how well can you inhale, how much air can your lungs breathe in, breathe out. So that's your spirometry. How well you can breathe in, actually, that's what it measures. So I think it would be good for you to have that kind of test if you really want to know if, whether or not your lungs are healthy. Okay, but you have to go to a pulmonologist. If you go to me, I will just ask you symptomatology, to know whether or not your lungs are healthy. Okay. Of course, some other diseases that you have, like asthma, you have any of these allergies, no? That's how I would know. But in general, every person living in the metro have lungs that are not kind of good, not purely healthy, because we breathe in secondhand smoke every single day. The moment you go out, you breathe secondhand smoke. Okay, it's just that the concentration of smoke, of the particulates that you breathe in. But if you're living in Metro Manila, yeah, you're gonna be breathing polluted air. Same thing with all other cities around the world, except for the ones that are really, really clean.
I want to ask a question. I mean, this is a personal question. First of all, I just want to say welcome, Joy. Joy is so cute. She says that good evening. Sorry she's late. No, we're so glad that you're able to join us, all right? And also thank you, Wing, for thanking us for the webinar. It's our pleasure. You guys make it worth doing. Now, I want to ask this question. If we have like for me, I run, right? I run. So is it an illusion or is it a good indication if I can run and I don't feel shortness of breath, and I can run like 5 kilometers without pausing, and I don't feel any pain and my breathing is smooth. I don't have like phlegm in my lungs or coughing. Is that like a good indication that, even though I live in the city, my lungs are okay?
Yeah, of course, of course. If you can run 5 kilometers, not everybody can run 5 kilometers. That's a good indication actually that your lungs are okay. But
Okay.
of course, no, to some degree, there will be heavy metals, I'm sure, that would be attached to your lungs because yeah, we're breathing in polluted air here in Metro Manila. So yeah, one way or another, there would be some particulates there. Yeah, compared to someone who's living in the province.
So I guess if you're able to at least exercise well and don't, like if you're walking up 2 flights of stairs and you're not hyperventilating, I mean these are indications that okay. I don't think we can say our lungs are healthy, but maybe at least we can say our lungs are not super unhealthy.
Yeah, it's still serving its purpose.
It's still serving its purpose, right? And we can and we can take care of our lungs. Reducing inflammation and all these things, detoxing, taking care of your liver, your kidneys, and all this are also important. I guess regimens to keep yourself healthy if you're concerned about your lungs and everything, because our body is not only one organ, they work in tandem. So when your lungs are weak, it affects other things as well. It affects the amount of oxygen in your blood. It affects then your heart has to work harder. So everything's interrelated, right? So I think back to the basic thing. If you don't have metabolic syndromes, no high blood sugar, high blood cholesterol, and low inflammation, it solves a lot of chronic illnesses. It gives you a very good baseline to keep healthy and to keep cancer free. So guys, don't just focus on cancer. Something as important as your blood sugar level, blood cholesterol, is your basic warning signs already. And it's your first thing that you can target to stay cancer free. Right? It's very hard to target cancer. Dr. Johnson will tell you there are 1,000,001 reasons why you could develop cancer on an individual basis. That, you know, however, there is something that you can target. You can target your blood sugar levels. You can target your blood cholesterol levels, right? And you can target the amount of inflammation in your body with your lifestyle. So you start by being able to control these things. You can affect or make a difference to your chances of developing cancer and staying cancer free.
Thank you, Sir Fran. I'm sure all of us can agree on that. Okay, now, just before we go to our next question, I just want to greet, of course, our viewers, Miss Denise Sayo, Naki Toilo, Joy Cabrera, and of course, Han Yuri, Wen Carino, and Miss Jim Apple. All right. So for our next question, how safe is the core needle biopsy? I heard that it's the cancer gets spread after the biopsy. Is this true?
Yeah, it is, no. Usually, patients who undergo core needle biopsy, yeah, you have an increased risk for seeding. So that's tumor seeding. So that's when the cancer can spread elsewhere, okay? Now, the amount of time, no. So once you undergo the core needle biopsy, you had to have the tumor removed within 2 months' time, because after 2 months, the risk for distant metastasis significantly increases. Okay? There's a way to mitigate that or to buy more time. So that is taking celecoxib or NSAIDs, no? That's non-steroidal anti-inflammatory drugs. However, of course, taking NSAIDs for 2 months is gonna be a very long period of time. Those drugs have its side effects. Typically, it's your stomach that will get affected, no? For this. So, you really have to plan it out. Once you get the biopsy, have the tumor removed. Okay, that's yeah. Once you commit it, you have to, yeah, no. Once you undergo the biopsy, you have to commit to the surgery. If I were you, okay. And the good news here is surgery is the only treatment, the only cancer treatment, no, that can increase your survivability, that can increase your what's the term, progression free rate, no. That means the amount of time that you're cancer free. Okay, so if you have a solid tumor, go for the surgery. Okay, because it will give you a lot of it can prolong your life, in other words. Yeah.
Thank you, Dr. Jansen. Okay, very quickly, another question coming from Ms. Jim Marie Apple. Is there a way to avoid recurrence after all the treatments?
Yes, it's by completing the treatments that you're undergoing, especially if it's radiation therapy, chemo, targeted, or whatever your oncologist prescribed you with. On my part, how I try to prevent recurrence is by way of IV megadose IV vitamin C, and by giving you antibiotics, no, because there are some antibiotic drugs that has been shown, no, with scientific research that it can kill cancer stem cells. Okay, another method is to use no, not to use, it's to starve the cancer cells, no. So I also repurpose some medications to starve the cancer cells of its fuel. So, of course, the most famous fuel of cancer is sugar. Metformin can do that, no? Another one is cholesterol. Your atorvastatin, your statins can help with that. And lastly, your glutamine. Glutamine it's an amino acid. Glutamine, okay? That's why glutamine is found in high abundance in milk, dairy products, especially whey, red meat as well, eggs. Yeah, okay. So those are the foods that has very high glutamine, and metformin can also help to inhibit the assimilation of cancer cells of glutamine, berberine, bergamot as well. So those herbs, no, and medications can help with that. I usually give that to patients, but knowing this, please don't self-medicate because I don't just give them left and right. I try to see your laboratory tests if the medication is good for you, if you won't develop any side effects with these medications. Okay, so don't self-medicate. Although you can buy the herbs or the supplements over the counter. Okay, so just be careful with those. Right?
Thank you, Dr. Jensen. Would you like to add anything, Sir Han? Or shall we
I
move
just
to the
wanted
next
to
question?
answer a question. Cherry Ann is asking questions, said, ask if we are accepting teleconsultation. The answer is absolutely yes. All right, and that's the preferred choice for Dr. Johnson, unless he's recommending some physical procedures for you. If not, teleconsulting will be best, right? So the answer is yes. Just type you want a teleconsult and someone will get to you. All right.
How to consult. Correct.
Doc, there's
I've
a question by Denise. Denise says,
Okay.
does taking stevia over time, can it cause cancer? I think the question, maybe Denise, maybe let me rephrase your question. Is stevia carcinogenic like the way we think aspartame is?
No. Stevia does not cause cancer.
But it
we
is
don't
sugar.
have any evidence.
Yes.
We don't have any evidence that stevia causes cancer, but stevia is an artificial sweetener. What I'm talking about here is the stevia that has been processed already. Okay, because the stevia is a leaf, right? The plant.
Yes.
So
why do
they
you say
process
that it's artificial?
they process the plant to
Okay.
form to make it as an artificial sweetener.
Mm.
So the stevia, I just don't know if it has been, what do you call that, trademark, the name stevia. I don't know if you can even do that, but
No, you can't.
artificial
You can't trademark
sweeteners,
names. Yeah.
it cannot cause cancer. But the problem there is, if you have cancer, your blood is easily more coagulable. It easily clots, and artificial sweeteners have been have been proven to to make your blood clot easier. So if you mix those two, so if you're a cancer patient using artificial sweeteners, you significantly increase your risk for heart disease.
Doc, you might want to share your famous recommendations in terms of what they use when they want something sweet.
Okay, just to add, I mean, this is an interesting question, and because I don't take stevia, so I didn't do much research, but though it's interesting because as I'm looking at this, it says that stevia is actually banned in Europe. So here's a very interesting statement. I'm just looking at this online, guys, so don't take this as irrefutable fact, okay? Still got to do some fact checking. So what's interesting here is just they say that there's inadequate toxicological data to say either way, right? And because of that, the EU decided not to put their government endorsement behind this. So I want to share with everybody. This is the key thing I want to highlight to everybody. This is why there are plants that are foods and plants that are herbs. All right. To help us understand more, foods are things that we've been eating for a long time. These are not just discovered plants. Foods are like potatoes, carrots, watermelon, banana. As a civilization, as people, we've been eating these for a long time. Okay, so these are no longer considered herbs. These are considered foods. So they are generally accepted as safe. Okay, so this is not to say stevia is not safe. It's just that it's something that is relatively new, being used as an additive or even a food. So it's not like our great grand ancestors have been eating them. We've not been eating stevia for 200 years, right? But potatoes, easily we've been eating them for more than 200 years. So these are foods. So that's why they are safe. okay, your kamote is safe. All right, if you find a new plant in the forest of Philippines, you can't immediately say that's a food. All right, it's something that nobody has eaten for an extended long a period of time. And that's why it's still classified. It will be probably classified as a new herb, right? Okay, so I just want to bring that point up. So even though stevia is natural, and there are many things that that are being marketed today as natural. Okay, I just want to let you know, even ginseng is toxic. There are different types of ginseng. There is the Western and Eastern ginseng. They will be considered the heaty or the cooling ginseng. And some ginsengs cannot be taken every day because there is actually toxic buildup if you take ginseng every day. All right, so ginseng is classified not as a food, it's classified as a herb. Lingzi, which is what a lot of people take if they are as a Chinese supplement if they have cancer, is also not a food, it's an herb. So many of the cordyceps are herbs, they're not foods. You can't take them in any quantity like without care every day. They will build up in your body and they will have adverse effects, even though they do have positive medicinal effects. So I just want to take the opportunity to highlight what are foods. Foods are things that have been tested for literally decades and centuries by a large number of people, right? So PPAR, just for example, why are PPAR tablets food? Because it belongs to a classification of microalgae that have been eaten for centuries, all right? They have been eaten for centuries. Even though our microalgae is unique, it's like, I don't know whether you studied early in school where we do grafting of plants, right? It's like your yellow kiwi versus your green kiwi, but they are all kiwi, right? So kiwi are foods. Okay, so that's the main difference and why PPAR tablets are considered food and safe. Okay, yeah. Sorry for the digression, little sidetrack over there. But I hope that at least it's interesting. Yeah.
No worries. Thank you, Sir Shyan. Thank you, Doc Jansen. Okay, another question coming from Mr. Jason Panglinawan. For those patients who had undergone chemotherapy, I'm just rephrasing the question, okay? Can Simply Nature PPARS avoid the adverse effects of chemotherapy medication?
Sorry, again, in English?
For those patients who have undergone chemotherapy, can Simply Nature reverse or prevent the adverse effects of chemotherapy medication?
Okay, I'll talk first, and then Dr. Jansen can support me. Yes, the idea of our Simply Paper protocols is exactly to do that. All right, and we do that in a few ways. Okay, PPARS actually modulates inflammation. So the moment you're undergoing chemotherapy or radiation therapy, your body undergoes a lot of inflammation. So you're strengthening your body's ability to manage inflammation, to modulate inflammation, will help alleviate a lot of the symptoms that you may feel. All right. The other thing is that we tested our products on chemotherapy drugs. They are shown to be able to protect your blood, bone marrow cells or from being destroyed. So that's very important for keeping your immune system up. So when you do that, all that combination, reducing inflammation, strengthening your different functions in your body, it will help you withstand the chemotherapy and recover from this chemotherapy in a much better way. Even weight loss is better managed when you are on a PPAR protocols, when you undergo chemotherapy. So to answer your question, the answer is yes. And how we do it is the things that I've just talked about, right? In simple terms. Yeah, Doc?
Yeah, my experience with patients taking PPARS and together with the chemotherapy drugs, no, the side effects become much manageable. It's easily managed, no. I'll give you an example. So chemotherapy, one of the known side effects is that it decreases your white blood cell count. Okay, when you take chemo, even when you take PPARS, yes, your white blood cell count will go down because that's chemotherapy. But the good news there is, okay, when your onco gives you filgrastim is a medication that your onco injects you with, no, to stimulate your the production of your bone marrow of new white blood cells, you would require less injections. So for patients who are not on PPARS, when they go for the chemotherapy, white blood cell goes down. It takes them 3-4 injections before the body is able to have a decent enough white blood cell count. Okay, but with Simply Nature PPARS, I have had patients who only took 1 injection, and
Wow.
the white count increased from 1,000. Okay, so here's the reference range. Okay, so some laboratories have a reference range of 4,000 to 10,000. That's what's normal. Okay, so when you take chemotherapy, your white blood cell count can sometimes go to 2,000, 1,500, 1,000, even less than 1,000. Okay, but with PPARS, it can go down to 1,000. Then when you inject the filgrastim, when you inject that medication, it can jump up to 15,000.
Wow, 1,000 to 15,000.
Yeah. So don't be alarmed, okay? It does not mean that you have an infection. It's just that it's because your onco injected you with the filgrastim. That's why it jumped from 1,000 to 15,000. But, with just one injection, you can have more than enough white blood cells circulating inside your body. So that's the value that you can get from PPARS. Less injections, less visit to the onco. No, side effects become more manageable. The side effects will be there because it's chemo. Okay, but yeah, it's easier to manage in that sense.
Doc, on the physiological or the scientific or method of action, so what happens is that with the injection, there's a stimulation of production of blood stem cells. And then with the PPARS, there is an assistance of the maturation of the blood, the stem cells.
Yes. That's what's happening.
And that's
by the way,
two work together. Wow, wonderful.
Yeah.
Wonderful.
By the way, this patient of mine took the liquid, PPARS liquid.
Yeah. So that's now you know what to take if you're undergoing chemotherapy.
Oh wait. No, not liquid, just the powder.
Oh, just the powder, right?
Wow.
Imagine. Now, if you take the liquid, then it's gonna be even better. But yeah, the powder itself is already so effective. Thank you. What good question that stimulated good answers and very interesting scientific answers also. So the injection stimulates your bone marrow to produce the stem cells, blood stem cells. The PPAR extracts help as much of the stem cells to develop into white blood cells as possible. So you actually need to stimulate the bone marrow less. So that's why you end up with less injections and you get that huge jump in your white blood cell count. And I think that what you really want is also speed in chemotherapy to recover your white blood cell count, because why? You have a schedule. You have a scheduled next chemotherapy session. So there is a time frame that you will want to be as regular as possible. And if I'm not wrong, if you can take more chemo sessions in a tighter time frame, that means if your body can take it, that would actually make it more effective or harder for the cancer cells to survive the chemotherapy regime. So I think the chemotherapy, spacing it out, is largely also to make sure that the patient can withstand all the side effects. So if you are able to recover quickly and keep to the schedule that is designed for each chemotherapy protocol, that's just going to increase your success rate in the treatment that you're undergoing.
Thank you, Sir Shyan. Thank you, Dr. Jansen. This is good news, of course, for those who are undergoing chemotherapy. Now, just before I read the last question for tonight, okay?
Oh yeah, it's almost 9 o'clock. Oh, wow.
Yes. Okay. Just an interesting comment. Mante Family's Blog said, guwapo ng mga doktor. Good evening po. Wow.
Oh.
They are indeed. Thank you. Okay. So for our last question, because we just answered a very good, an encouraging way to go for chemotherapy for those patients who are undergoing that. But how about those who are scared to go for chemotherapy? The question is there any other alternative way other than chemotherapy that can really kill the cancer cells?
No, this one I like.
There are a lot. One is, of course, Simply Nature PPARS. No, they have a lot of scientific research where we saw apoptosis. So that's cancer cell death. No, when the subjects were given PPARS. Another one is mega dose or high dose IV vitamin C, high dose intravenous vitamin C. Okay. Another one are the medications, the repurposed medications that I mentioned a while ago. These medications again are repurposed. Okay, so these medications are out there in the market with its intended use already. So, for example, metformin. Metformin is mainly used to treat diabetes, but I repurpose that for cancer cells to kill cancer cells because there are a lot of research papers that has been that yeah, it has been proven that metformin can actually kill the cancer cell. It's just that FDA it's not approved it to be so is because the companies that manufactures the metformin did not apply for this purpose to FDA. Okay, because there's no money that can be made from this medication.
Yeah. That's why I was about to say that.
Metformin is dirt cheap.
Yeah,
it's not gonna be. Yeah, the companies won't have a good return of investment. It's just gonna be. They'd be wasting money to do
and
so.
there's no more patent protection also.
Yeah,
because
but
metformin
there are. It's good though that we have these third-party researches. These researches have been coming from everywhere. There are a lot, no, multiple different countries, different nationalities that does these researches. Which is really amazing and really thankful for those researchers who are doing so. So that's one. Another one would be some supplements as well. No? I know Simply Nature PPARS is a supplement. Aside from them, berberine, bergamot, no. These supplements can also be used to repurpose no, for treating cancer. Antiparasitic medications like ivermectin and mebendazole, fenbendazole. These medications have also been proven that they can induce cancer cell death. So I am using these medications for my cancer patients who are not undergoing chemo, not undergoing any oncologic protocols. So these are some. Okay.
So to add to what Dr. Johnson has said, whether you go for conventional or non-conventional, my one thing is this: you want to at least. You don't want to just stick to one approach. I think that is my answer. All right. I think the minimum approach that you have to definitely include one is you got to at least work from the nutritional point of view. Okay. Whether you want to do vitamin C drip, ozone therapy, or chemotherapy, radiation therapy, the one thing that you need to do is you got to go for the nutritional approach, because that has no side effects. All right, that's like the basic thing. You got to strengthen your body to be able to function as it was designed. Right, your immune system got to be working. Right, so so don't just say I take my chemotherapy and radiation therapy and I don't look into basic supplementation at all. Right, and you shouldn't say that I'm taking vitamin C drip or ozonization, and then I don't care about my basic supplementation, my basic nutritional. So I think this is very important. Nutrition is the very basic that is fundamental, no matter what. So this is where PPAR tablets really come in. There's a basic nutrition, helps you manage lots of stuff. Now, the extracts will fall into the same category as, like, for example, taking vitamin C drip, in the sense that they are a lot more potent because they are extracts, right? And that is then up to you to choose how you want to combine the different approaches. Now, if you are not sure whether the products that you are taking right now are effective at all, then go for a consult with Dr. Johnson. Okay, and then you can tell him, I'm taking this direct marketing company's product. They told me this and that. So Dr. Johnson will probably be quite familiar with some of them. And just by looking at the ingredients list, both he and I can already tell you, okay, this is harmful, or okay, it's okay. You know, you feel, if you want to take it, feel free to take it, but we're going to tell you, take some of these other protocols that we are sure are going to help you. All right. So I think, yeah, because there could be 1,000,001 variations out there that you believe in. Now, instead of telling you that what you're trying won't work, because we don't know until we look at in detail what you are trying, right? So the ones that me and Dr. Johnson share are the ones that we are knowledgeable about, and we're confident that it will help you in your fight against cancer. Now, if you really want to know more, you can always just arrange for a consult, and we would, or you can bring the specific item up during our next Ask Me Anything segment, and we will take a look at it, right? And everybody can learn from that. And I think the safe thing, right, Doc, that we can probably be able to tell from most supplements is that if it's safe to take, right, that it won't have a contraindication. For example, you're telling me you're taking barley green, right? That's fine. It's not going to really affect your fight against cancer, and it might even help, right? So things like that. Last question I'll answer is, someone asked, is there a maximum limit in taking PPAR powder? How many scoops in a day for lung cancer? Okay, the answer is, we've done our tests. We've done a lethal dosage 50 tests. There's no long-term toxicity build-up. And also in the short term, there are no toxicity build-ups also. At the very extreme case, if you take like a lot, there is a bit of a hyperactivity because your body is being overstimulated even by nutrients, right? If you take too many bananas, you get LBM, right? That's the kind of reaction that you can get. So my straight answer to you is no, there is no actually maximum limit, all right, that you can take. So what's the recommended? I think, Dr. Johnson, your heaviest dosage for any patient that you have recommended for powder is how much?
10 scoops a day.
Oh, 10 scoops a day.
10.
See, that means a jar will probably finish close to 10 days, 7 to 10 days probably. Yeah, at 10 scoops a day, right? Now, even for the liquid, from my experience, I think the most I have encountered on a sustained basis, that means every day, there have been patients that take like 4 or 5 vials a day, and that's actually quite a lot. All right, so I don't think for Glenn, you will come close to this level of amount. So I think if you're taking like 2 to 3 scoops a day, 3 times a day, 2 to 3 scoops 3 times a day, I think you're still absolutely fine. Just to let you know, my beloved dog, okay, again, when I say this, please, no one get offended or anything, okay? I'm not saying anything. I must be careful what I say, all right? But my beloved dog managed to get to my jar of PPARS, all right? And he finished the whole jar in one licking session, okay? And he was absolutely fine. Okay, why did I bring this up? Because you got to understand, my dog is only 14 kilograms. He's only 14 kilograms. We are usually about 50 to 70. Yes. Some people are a bit more than that, right? And he finished an entire jar. So upset. It was a new jar too. An entire new jar in one night. Okay, and absolutely, he was fine the next day. Yeah, nothing. He wasn't even hyperactive or anything. So that just go to show you the extent. And we proved this in our LD50 test. Okay.
Thank you, Sir Shyan. Okay. All right. Well, I'm curious, is that already your particulars? Because there are so many
takeaways. Yeah, I
already.
think so. So we'll let Dr. Johnson close. I already said my particulars. We'll let Dr. Johnson close.
Yeah.
Thank you, Sir Shyan.
Yeah, so just want to thank all of you, for listening to us every single week. I hope we really gave you a lot of value for this. If you want to go for a consult, if you want to ask some questions about your case, just set up an appointment so they can get you a slot. Okay, the slots are getting full. I mean, yeah, but next week I think it's still manageable. Okay, so but it easily gets full nowadays. Yeah. So yeah, grab your slots early. Okay, so thank you everyone for always watching us every single week. And it's really you. That's why we're doing this. It's really because of you, no? That's why this program has been quite a success. Okay, so that's all.
Yeah.
That's all. So thank you everyone.
Thank you, everyone.
I'm sure our viewers can also say that we are very happy to have you both back. And thank you once again for answering all our questions tonight. And of course, our future questions. Okay. All right. Now, at this point, okay, I'd like to invite everybody. Right? Once again, we are calling out all the cancer patients, survivors, and advocates. Let us all come together to explore the latest advancements in cancer treatment and engage with the multidisciplinary experts dedicated to enhancing your well-being. This is happening this July 27 at SMX SM Aura at 8 a.m. So please do watch out on how you can buy the tickets to this very exciting event. Okay, we will be posting it definitely on our Facebook page. Okay. Also, at this point, I'd like to invite everybody this coming Thursday once again at 7:30. Coming this May 2. Oh my goodness. This is our first webinar this coming this next month, May 2nd. The title of our webinar is Prevent Cancer from Coming Back, a Guide to Preventing Relapse. Very interesting and very encouraging as well, no? As we always say it here, look beyond the treatment as soon as possible. Okay? All right. Now, we are very, very happy to have you all tonight. And happy also that you will be also joining our next webinars to come, because your victories over cancer is what keeps us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself. How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, indeed, the tumor was gone. It's just a cavity. It's not enhancing.
Now you know, cancer eats what? Cholesterol, right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening, right?
Especially if we are talking about solid tumors. The number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwede sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong, plus very honest sila sa mga questions, sa mga pagsagot sa mga questions. Basta, nasasayahan ako. Ganun.
We're always with you from start to healing.